me sterilize this first, okay. Put your hand on the side of my head. This is what I do to my patients. Feel that? Mm-hmm. And so once they feel this muscle bulge in and out, then I bite this hard, stable object, and I say, I think that thing is killing you because you squeeze like nobody's business when you're asleep. Some nights you do it like off the map. And some nights you just sort of don't actually get there. And you wake up feeling not too bad. But it hurts right now to push on it. It's just waiting for something to irritate it. And so, and sometimes I'll say, so there's these little threads in there that start to spasm based on the stress. It's always waiting. So I think if we can decrease the intensity of that activity every night, those threads won't be so irritable. This person, I think, is an ideal candidate. The moment I pressed on her temporalis, it's over. But now you can see if you ask this question in the morning, do you feel fabulous? You get a 0, and she says, yeah, 5. Like, yeah, right back to you. You know, it's like, okay, Jim, what's he going to say now? I sort of snooped around, and all of a sudden, you know, having 5 days of a number in the morning wouldn't be weird. You wouldn't want to admit to it. It could be higher. She can get 6 days of misery, and you push right there, and it hurts. So I think that's a variable in her sleep pattern. So when you go to the dentist, what's that like?
It's okay.
Are your teeth ever sensitive?
Sometimes sensitive to cold on
You ever had
this side.
a filling or a crown done on the bottom teeth?
Yes.
How does it feel when they drill on your tooth?
Well, as long as it's numb, it's okay.
Is it ever not numb?
No, no.
Always totally numb. You never feel them drilling.
No, I think I recall one time when it was maybe taking longer than expected, and it was starting to wear off a little. And
okay.
But
okay, open real wide, close. Open real wide, close. Open real wide, close. Now go. Make your jaw go backwards, and close and squeeze. Squeeze real hard. How bad does that hurt?
that doesn't hurt.
Does it hurt how your lower teeth feel about that?
Okay.
How does it feel like it's squeezing? What part of, where's Mike? What part of where does it hurt on your top teeth? Where do you feel the pressure?
It feels like it's squeezing them this way. It's hard to talk.
That's fine. We talk like that all the time.
It feels like it's squeezing them, my two front teeth together a little bit.
So I'll relieve those interproximal wings. That's probably where it's coming from. And then if it's too loose, you just slop in a little sloppy reline and it'll be fine. But what's encouraging is she can go bang on the thing. Doesn't bother her lower teeth. So now you're doing all these kind of things and stuff, and she instinctively brings her jaw forward on that every time. You know, it's hard to get her to go retrusive, but she does it after a while. And then you would ask this patient, you know, so does this feel like it's sort of challenging you or anything?
No.
And if they just say no, it doesn't challenge them. Sometimes they're squirming around in the chair, and they just... You could see it a mile away. You know, you can either say, would you like your vertical dimension decreased? Yeah, that's what I want, because something's weird about this thing. So let me see something else. Open up, bite down, and grind to the side. And then go the other way. It's about 1.5 millimeters clearance both ways in retrusive, because that's where her power clench is going to be. When she protrudes, these things get farther apart. And if you were deceived and you looked in there and she bit down in protrusive, there's lots of clearance. Don't take it out, but don't use your hands, though. So put your fingernails on top and pull down like that. Okay?
It's easy.
So when she comes back in 2 weeks, you'll say, you know, how many, what would be the best question? How many mornings a week are you waking up with a 0? Just keep asking the same questions again. So she might say, you know, I don't have headaches at all when I wake up now. When I get them is, And so you see how much you might need to wear that during the day, if at all. But the whole point is what's the protocol for diagnosis and for application? And once you're in the swim of things and the patient has that initial dose of positive effect, they're on your side. They'll help you through it. They'll say, oh, this is bugging me, can you do this, can you do whatever they say. They will say stuff like this. It's in their mouth and they're moving their jaw around and they'll say to you, where do I put my jaw? That's what you wanted. I say, well, okay, now what do I do? What do I do? Here's the verb. There's occlusion. She needs to know, where's my occlusal scheme, because I want to make one. They don't know what to do, which is a jaw contraction. It's a place to put, a place to occlude, which she thinks is a version of normal. So when they say that, instead of going like that, I say, I want to tell you something right now. The condition is standing on your shoulder right now, and it just told you, ask them where to put your jaw, because you need to put your jaw somewhere. Did you know that? Ask them that, because we need to do that. So you actually think that having your teeth together is normal because your condition is telling you that. Well, yeah. Put your tongue on the bump. There's the verb, there's the action, there's the do. And they go, okay, that's all you have to do. Put your tongue on the bump. When you wear the daytime device, put your tongue on the bump. So when you're not wearing the daytime device and then you get stressful, your tongue goes to where the bump was. There's your biofeedback. So when they ask, where do I put my jaw? You say, isn't that weird? You're not supposed to be putting it anywhere. So in order to keep things going, I think you're done. So wear that tonight, wear it every night, take it out in the morning.